I'm Savannah Levins with 11 Alive Investigates. When Mentzer was appointed executive director of the Atlanta VA healthcare system, he admits he knew he was walking into a challenge. In its last hospital ratings report, the Centers for Medicare and Medicaid Services gave the Atlanta VA only 2 out of 5 stars in overall quality. Safety, patient experience, timely and effective care, all areas patients noted were lacking. A week into the new job, Mentzer agreed to sit down with us for his first ever news interview. Here's that full conversation.
Have you done a sit-down interview before?
I have not.
Why did you want to do one now?
I think it's important to share with the 160,000 veterans that we care for in Atlanta and the 5,200 employees what my priorities are.
I want to start talking about your military service, less about the points on the resume, which is very impressive, but more so about how it shaped you into who you are today. I saw you got into the U.S. Army in 2003. I imagine that was a very unique time, post 9/11. How has your military service shaped your approach to leadership and shaped the man that you are?
Yeah, great question. And you're right, our resumes are bullet points, and I don't think that they do justice for what I think many leaders have been through. I am an Army veteran. I did join the United States Army in 2003, and as a nuclear biological chemical specialist, I served both stateside and in Afghanistan and South Korea. And, the Army was my second family. I didn't come from much, and so having that opportunity to be a part of a big family like I'm a part of meant a lot to me. And the leadership that you get in the United States Army, to me, was second to none. It was an opportunity for me to grow and learn from other senior leaders that have been in for a very long time. It had the camaraderie that I enjoy, the structure that I think is important. And as a director of a hospital, to tie that back into how that kind of helped me, I had a lot of opportunities in the Army to travel, and the VA offered those opportunities. As a veteran, I get my care here at the medical center and have at every medical center I've been to. In fact, I started in the VA as a technical career field intern. So we call them TCF interns. I was an intern in housekeeping. So I started as a housekeeper in the private sector and then realized and recognized that the VA was really where my passion was to continue to serve with veterans and for veterans. And when I realized that, I thought I have to go work for the VA. And so as a TCF intern, I was able to really be a sponge for everything in the environment in the hospital. Part of my responsibility as an intern was to learn as much as I could in the 2-year internship and grow from that. And so I was very fortunate to learn the VA from the ground up, starting as an intern. From there, I was fortunate to be asked if I would go to the Bay Pines VA healthcare system in Florida to help out. And so there's about 115,000 veterans there when I got there versus the Tucson VA had about 60,000 veterans. And in the Bay Pines VA, I continued to work in the Environmental Services Department as an administrative officer. It was the largest EMS department in the country at the time with about 400 people, where I served as an administrative officer and then an assistant chief. And then the director at the time asked if I would come and serve as her executive assistant. And before then, I hadn't really seen myself becoming a senior leader in the VA, and she helped me to see that that was a potential, that was an option for me. So I decided to go work with her. And did that for about 3 years before she said, hey, there's some really good leadership programs in the VA. One of those I'll talk to you a little bit later about. It's called Healthcare Leadership Development Program. It's one of 3 premier leadership programs in the VA that I was able to take part in. And this program I went off to, was able to take part in, sacrifice time away from my family to become the leader who I am. And that program led me to the Louisiana VA, the Overton Brooks VA Medical Center. And for about 2 years I did that, helped them, learned as a senior leader, led a large organization again. And then the Jackson VA Medical Center, the network director asked if I would come and help out the Jackson VA. And so I was kind of being pulled in these different directions to really there was something. To me, it was maybe my approach to accountability, the way that I interact with staff. The focus on culture for me was always important. But I think it was the relatability that staff have with a senior leader who's a veteran, who always gets his care where he works. And so I got to Jackson, Mississippi as an acting associate director, then became an associate director, and then the medical center director over that 6-year period. And then once again, Atlanta was an option for me. And so to me, it's important that you have leadership support. And there was a lot of leadership support for Atlanta to becoming, a great facility, a great healthcare system. And then to me, it's important that my family had an opportunity to grow. And so I've got a 12-year-old and a 9-year-old, and I'd like for them to have, some really good school systems to be a part of, to at some point, graduate from school here in Georgia and look back on, how Georgia became their home.
Yeah. I think you bring up some interesting points that are unique in that, you really rose up through the ranks of the VA through hard work. You didn't just come in immediately as a senior leader, and also that you receive care in the places that you work. In what ways do you think that potentially makes you most qualified to take on this position now as someone who's worked through the ranks and seen it firsthand from all elements?
Well, in each of those hospitals and organization that I worked for, I was able to, I think, really understand and learn the nuances of a healthcare system. And so there's 176 VA medical centers, and they vary from very small medical centers with only outpatient care to very large medical centers like Atlanta, the second largest in the country. And at each of those medical centers, I was given the opportunities to lead large groups and make organizational changes, and then watch those changes sustain over time. And I couldn't have done any of that without the staff around me and the staff in the hospital. And so each of those facilities, all that sacrifice of relocating my family across the country to work for those veterans in those areas, has all really led me to becoming, I think, the director here in Atlanta.
With all your experience on the healthcare side and with veteran care, what are some of the biggest lessons that you've had to learn that you're taking with you into this new position? So there's really 5 things that I try to focus on at every organization. And the first one is the veteran and the employee experience. And so one of the greatest, I think, things that we can all learn as leaders is that if we have happy staff, we have happy customers. So that mentality of really focusing on our staff as a leadership team so that the staff can then focus on our veterans, right? That's one of the most important things to me here. The second one is, a little bit of a nuance to that is the veterans experience is just as important as the quality of care that our veterans are receiving. And so it's something I really want to work on here in Atlanta, is that veteran experience through the staff. The second one for me is employee growth. So an organization this large, any organization in the VA, this should be the employer of choice. This should be where our staff go and work to become directors someday. This should be the opportunity for them to learn and grow as employees, and if they desire to get that growth and are willing to make the sacrifices as I did, to relocate and or within the same organization. So to me, growth is an opportunity. I'd like to bring some leadership programs to this VA. And then third priority for me here in Atlanta is improving that stakeholder engagement. So this interview itself, I think, is a good opportunity to say, look, I'm open to do interviews. I think, there's a lot of support for veterans in Georgia. We have more than 20 sites of care, and I haven't been able to visit all of them. I plan to visit all of them next month. But before my arrival, I was already on the telephone with Senator Ossoff and having conversations about where's a good place to live and what kind of support. And so to me, that's a good example of the support that we have here for the veterans in Georgia. And plan to meet with both him and Senator Warnock next week, or their staffers,
that stakeholder engagement. The other one is the VSOs, our veteran service organizations. Before my arrival here in Atlanta, I've had more than a dozen invites to come speak at those different stakeholder engagements. And so engaging with our stakeholders, being open to go out and spend time with them is something that's important to me here in Atlanta. And I think the last one, and not last, but maybe a significant focus for me will be on the quality of care for our veterans and improving that access to get that quality of care here in Atlanta. So we've done a lot of improvements. Before my arrival, the team has done a great job with improving. There has been some improvements in access for the organization, but really focusing on, while we're improving that access, getting that veteran the ability to be here, also focusing on making sure that when they're here, they're getting healthier, so that they can be around for the Juneteenths and the July 4th holidays, spend one more time with their family that maybe they wouldn't have otherwise had.
Yeah. You've touched on a lot of solutions, which, are great. You are inheriting a lot of problems. I mean, in the past few months and years, we have some of the highest wait times in the country. We've had nurses protesting unsafe conditions. We've had VA police, charged criminally. We've had, all of these things kind of making headlines, so to speak. To what extent have you done research coming into this? I can kind of tell based on your solutions answers, but to what extent have you done research into what you're walking into? And what of those things is priority number one that will trickle down, do you think?
So two things. One is, yes, I've done a lot of research. I very much appreciate that question. As I was leading the organization in Jackson, Mississippi, every time I got some form of data or information or tasker, I would look at what's happening in Atlanta in preparation. So 6 months ago, I started really following what was happening in this organization and comparing it to what was happening in my organization, and then meeting with some of those subject matter experts at my hospital in Jackson to say, if you were in Atlanta, what would this look like? And really garnering that understanding of what it would be. The second thing that I think is real valuable in what you said, and that was, there has been a lot happening here in Atlanta. And I think we're very fortunate that there are a lot of staff that are willing and have a strong desire to improve this organization. You mentioned the union or the nurses. So today we had a large number of nurses, more than 20, come visit me in the office. And I talked with them about their concerns. And before I left the room, they said, thank you. And one of them said, we've never had a director do that before. And so to me, the transparency that I want to bring, the communication that I want to bring, streamlining that communication, that engagement, this brings you back to that, is important to me. In an organization this large, it's not something one individual can do. And so those are stakeholders. Right? The nurses are our largest group of providers in this organization, and it's important to me to be accessible to them.
Mm-hmm. I think that's great. I was going to ask you if you'd met with, those staff members. So your approach here, I imagine in your first week or first month, this is going to air July 1st, what's your approach to, tackling a lot of this? Is it all meeting with, high level leadership? Is it also meeting, like you said, with nurses? Is it meeting one-on-one in big groups? How are you tackling this?
Yes.
Yes to all.
So I've taken a tiered approach. Arriving here, I think it's important to really have some permanency in the leadership team. And so the first day I focused on not really being disruptive to the organization, allowing the organization to show me where they're at, being present, being available to them. I met with a lot of folks one-on-one in the first week. By the end of this week, I'll have all of my direct reports wrapped up one-on-one. But kind of from a from a tiered approach, met with my leadership team. Last week on Wednesday, I had a meet and greet with the director, with the frontline staff. Before that, I met with all of the clinical and administrative leaders in the organization in person in our auditorium to really do some question and answer, let them know some of my priorities. And then, I've tried to meet with our congressional leaders to be able to have some time for them to come visit me come visit them. The plan was this week, next week. And then, as I'd shared, kind of getting out into the community. So I have a couple of events with some veteran service organizations coming up on the calendar. My message for anyone that wants to help support the VA is let us know, right? We have a very robust voluntary service department. If there's volunteers out there that want to come support this VA and make it the VA that I know it can be and be a part of my team, let us know. When I was meeting with the nurses today and our administrative union yesterday, they both shared with me there are a lot of people knocking on our door that want jobs. And so, to me, that is an indicator that, yes, there might be some negative challenges in the organization, but if there's people that want to work here, it lets me know that it's a good organization.
To that point, the wait times is something that we've covered extensively. A lot of facilities deal with this nationwide, but the Atlanta VA in particular, in 2022, when we first did the investigation, people were waiting about 73 days on average for certain procedures. It was over 200 days for GI. Oncology, even now, is a couple months from what I saw this morning. I imagine a lot of that has to do with staffing, but what do you think is contributing to that, and how do you address that problem?
So every time you ask a question, I can smile, and I love it. So it's a great question, one that I think is a challenging one. So first and foremost, the way that we capture the wait times and publicly present that it's difficult to understand. So our veterans choose to come here, and if they choose to wait 6 months, that becomes part of the average. So, yes. So it's not an indicator of when our next available appointment is, because in most areas we have walk-in appointments. Our providers, if you speak to them, they'll make it happen, right? They'll bring a veteran in, especially the emergent, urgent ones and the needed ones. The challenge becomes when we try to have those conversations repeatedly. And so our veterans are willing to wait. And so it skews the numbers quite a bit. Now, that's not to say that we don't have access challenges. Atlanta is not only the second largest VA in the country with 160,000 enrollees, it's also one of the fastest growing in our country. And so it's difficult to fill the positions as fast as we're growing. So if you look at the rate of growth in Atlanta, it's about 3% over what occurred last year. And if you look at the 5-year growth, it's about 10%, right? So when we grow so rapidly, it's difficult to bring those providers on so swiftly, in addition to space. And so, yeah, it's been a quick 10 days. Last week I met with Emory. We had an evening conversation for about an hour where we discussed the opportunities of maybe partnering with them on space usage. I met this week with our facility planner to talk about space usage. Last week, someone shared with me that not only are we the second largest, but we also have the largest population of female veterans in the country, with 27,000 female veterans. And so that conversation was also surrounding getting additional space for us in one of our clinics in our catchment area.
In addition to the space, do you think the pay is competitive enough?
So we're very fortunate to have I'm a stickler for pay. And so what I mean by that is, I want to be able to pay and recognize the staff for the work that they do. And so there's a process that we have in the federal government, we have in the VA on an annual basis where we review the pay to see how comparable we are to the community for many of our positions. Now, not all of them, but for many of them. One of the other things that I like to do is recognize staff for going above and beyond in the VA. That's not something I've been able to touch on here in Atlanta just yet, but establishing an awards committee and allowing the governance to help us as a leadership team make the best informed decisions to really recognize the staff for going above and beyond.
Yeah, I think that's great. I think a nurses union survey recently showed that a lot of them didn't feel appreciated, or that they had upward mobility. Another thing they mentioned in that survey was 8 out of 10 nurses who left their positions cited fears or safety concerns. Is that something, I imagine, that you might have heard in those meetings with nurses, and is that something that you have planned definitively to address those safety concerns?
So I haven't heard the fear or safety concerns yet. And like I said, I met with NNU this afternoon, about 20 nurses, and I'll meet with them. I meet with them every other week. So I'll bring that up with them and see if there's any concerns that they have. They did bring up some pay concerns that they had from last year that I helped to address so that we can move forward this year. And our annual survey will occur this summer for the nursing staff. I do want to talk a little bit about safety, though. Safety is important to me. As I focus on the staff, safety of the staff is probably the priority, right? That's why we have the new magnetometer system. It's called Evolve, that allows both employees and visitors to walk through that during our peak times as we look to provide a more safe environment for our staff. Another opportunity that we have is a safety reporting system that I review every day as a director. We probably average about 10 of them in the last 10 days that I've been here. And that safety reporting system is called Joint Patient Safety Reporting. And the joint for me means that it's a joint exercise between the frontline staff and senior leadership. It's an opportunity for them to report to us any of the safety concerns they have. More times than not in the VA, those reports are actually reports of near misses. In other words, a mistake almost happened, but I'm going to report it so that we don't spread it, we don't allow it to occur anywhere else. So that's a really, really good system that we have in the VA that allows all the senior leaders in this organization to review it every morning. The last 24 hours, what came up, what are we doing about it? And then we have a turnaround time and a process to focus on what solution we had for that specific mistake that occurred in the organization. Things like a carpet, maybe that was turned over, that was frayed, and a veteran, slipped on it or trod on it, or a staff member, right? Things like, we're waiting on a bed to be turned around, and to us it's a safe issue because we have a veteran who's in the emergency department a little bit longer than we'd like, right? So very, very simple things, just things that are very complex, right? To a veteran bringing up a concern that we had no idea about, maybe at home. One of the safety challenges that we're facing here in Georgia that's come to light is the transporting of veterans from one of our outlying clinics that might be 2 hours away. And what's the best approach to a veteran that may be presented with mental health concerns to get them to our hospital? My understanding is that there's some challenges with maybe utilizing some of the emergency management services in those areas to get them here. And so what's the best approach? And that was brought up by some staffers that said, we want to provide the best care for our veterans. So what do we do in this situation? And we're working through a process on what's the best approach to get that care managed for that veteran in those outlying clinics.
In your first week or weeks, do you have a mental kind of checklist going of things you want to address, and what has stood out to you so far that wasn't already on your radar coming in all your research?
Absolutely. I do have a mental checklist. For me, it starts with the environment for our veterans. I'm a younger veteran, and I appreciate an environment that's a little bit more modern, and I know that's a challenge in the VA. And so one of the items that's on my list of priorities is where are we at as an organization with remodeling the facility? Where are we at in investing in the infrastructure? Simple things that you or I might do at our house and our homes, provide a savings account to replace the carpet, new flooring, new paint, new furniture, those kinds of things in this organization. It wasn't something I was able to do research on to see where they've invested their money and time in. And those kinds of things make a difference to me when I walk into an organization. I think we're pretty fortunate in Atlanta to have a really good housekeeping department. They keep the facility pretty clean. The challenge is that you can only keep it so clean for so long before you have to start to invest in new furniture and new carpet, new walls. The first thing the veterans see when they come here are the roads and the parking lots. And so to me, in the very first few days, I started to have conversations about what are we doing to, restripe the lines, put some new blacktop down. How are we doing with handicap parking? Is it sufficient for our veterans? All those kinds of things were the challenges that I saw when I first got here. Other things on my checklist is really just communicating more often. Having a rhythm to communicating with the staff. I haven't fully grasped just yet, what the staff like here, whether it's a town hall on a recurring basis, whether it's emails, that system, or walking around and doing tours. One of my favorite things to do as a director is to meet the staff, get out, hear from them what the challenges are so that I can bring those challenges back, or have them work on those challenges and let me know what barriers they encountered so that I can help remove those.
Yeah. Are there any, speaking of barriers to everything you want to do? I imagine there's a lot of change that you want to implement quickly, or a lot of improvements you want to implement quickly. How are you approaching, maybe whether it's budgetary or otherwise, hurdles to doing all of this so quickly?
Yeah, that's a great question. I used an example this week that sometimes it feels like I'm a bull in a china shop, and the team helped me to remember that this is my china shop now. And so I have to decide, what that priority is every day. And I keep the veteran at the forefront of everything that I do. And so every decision that I make, whether it be to sit down with you for 30 minutes, prepare for the conversation, an hour, the day before, 2 days before, that is so that the veteran sees what the priorities are in this organization. That's so the veteran knows who I am as a leader and that I'm willing to speak to them. When we put the veteran at the forefront of everything we do, the resources, the budgetary constraints, those all fall aside because our focus is on the veteran. And so, I know a lot of the senior leaders in the VA, and most of them have reached out to me, sent me text messages and said, let me know what you need so that we can help support the Georgia veterans. And so, my plan is to find out what it is I need and then reach out and take them up on that offer to help us out here in Georgia.
You mentioned off camera you're planning to visit a lot of these facilities, meeting with some of the staffers of our senators. What are some of those questions that you're really going to be asking pointedly, and what do you want to glean from these conversations and these visits?
So 2 parts. First, I'll speak to the senator conversations. To me, it's important to know, as they're our board of directors, what's important to them. And in having conversations with them already, access was one of the challenges that they brought up. So to me, it's important to focus on improving that access, really sharing that access. I will have monthly meetings with their staffers to go over what our access data points are, what maybe taskers or action items I have remaining to help support them. I really want to know how I as a director can help support the Georgia veterans. And through that, help support them in asking their peers when they go to Washington, D.C. and what support they need for the VA. The second part of that question is the staff at all the sites. So I have shared. We had the National Improvement Office come visit us last week. Some colleagues, some friends of mine came to visit, and they actually came to Jackson when I arrived there about 6 years ago, and Jackson was in a similar state. There was a lot of stuff to work on. There was a lot of quality to focus on, a lot of patient experience, and that same National Improvement Office team has been coming here in Atlanta for about a year, shared with me because we had worked together for about a year to get Jackson where it is today. In an organization that sustained those changes. And so that National Improvement Office, they said, what do you want us to tell the staff when we meet with them? And I told them that I want the staff to tell me what their challenges are. I want them to feel comfortable to bring it up. Because if I don't know what's out there, then I can't help fix it. And it's not that I'm personally going to fix all of these. Right? It's that I want to be able to help remove those barriers, as you said, to help them get to providing the best care for those veterans in Georgia.
I want to loop back to what you said real quick about the wait times and how the system for calculating those may be a little flawed. I've been thinking back as we've talked to some interviews. I've had one in particular with a veteran who was having some heart issues, and she had to wait 6 months for an appointment. I read a lot of the correspondence where she was being delayed and pushed back. She had a heart attack in the meantime while she was waiting. And we've covered a lot of stories like that. For those people who are saying, I'm living this, I am having to wait this long, and I know it for a fact because I'm living it. What would you tell those folks? Is there going to be an emphasis too on really figuring out where those gaps are?
Absolutely. First and foremost, I would tell that veteran sorry. No veteran should have to wait that long to get the care that they have earned and that they deserve. When I hear stories like that, it makes me get emotional as a veteran, which the veterans out there know that most of your emotions are pulled from you as you go through. It really hurts me at the core of who I am as a person, because that's something that we did wrong. Because the way that the VA is really formed is to get the veterans the qualitative care as quickly as they need it. And so absolutely, what I would tell that veteran and any veteran out there that's waiting is to please let me know. Let me know that so that I can work on that for you. The second thing I'd say is, as a veteran that gets, I get my care at every VA I've worked at. I will get my care here. There's 3 things that I want as a veteran. The first one is access. right? I want to be able to come to the VA when I need to. I want to be able to get my appointment when it makes sense clinically, right? The second thing that I want is I really want to get better after I've come here. And then the third one is that while you're providing care for me, I want you to be friendly. So it's really not a big ask as a veteran, and maybe I've oversimplified it, but if you can get me the care when I want it, make me healthier, and be friendly while you're doing it, I'm a really satisfied veteran. And what you just shared was an example where that didn't happen. And so that's difficult for me to hear.
If I sit across from you again a year from now and 5 years from now, what do you hope has been accomplished in a year and again in 5?
So I'd say a year from now, I would like to see significant improvement in every data point that we have, every metrics, every access measure that we have. And if we can't improve it, we can speak to the exact specifics of the challenges surrounding it. Providers are a limited resource, not just in the VA, but in the country. And so if I can't improve access at the VA, I would like to think that there's a challenge in the community as well, because community care is an option for our veterans. And if the access in the community is there, then we need to be sending our veterans out there to get that care. I'd like to have my family established in a house. That would be fantastic for me and my family within the next year when we meet again, and we can share those stories. In 5 years, I'd really like to see all three of those very specific points, us being successful at that. That's providing care when we want to provide it, when the veteran wants it, and that it makes sense. Being friendly while we're providing it, and helping those veterans, as I mentioned earlier, getting to those holiday events with their families. The summertime is among us, and those veterans deserve to spend time with their families.
What are your final thoughts? Any final things to add or mention? Anything you want to say to address veterans who will be watching this?
Yeah, one is thank you for having me. I say that over and over again, and the staff are like, no, thank you for being here. I genuinely do feel like that I'm fortunate to be able to be here as a veteran and as a director in Atlanta. It's been a very warm reception of not just the staff here at the medical center, but the community as a whole has been very receptive, very friendly. I want the veterans to know that it's a new day. It's a new time. Please bring forth the options, the challenges that you faced in the past that maybe weren't addressed at that time or to your liking, and allow us to have a conversation. I'm a transparent leader. I enjoy overly communicating, and I'm glad to be here.
You can watch more of our reports right here on 11 Alive Plus. Just go to the 11 Alive Investigates carousel.
If you have a tip for Savannah Levins and the 11 Alive Investigates team, call us at 404-873-9111 or email investigates@11alive.com. All calls and correspondence will be kept confidential.